Good evening and welcome to our COVID-19 update. I'm Ladi Akiridoluale. Here are the highlights at this hour. Ahead of school's resumption in Delta State, institutions receive palliatives, just as Benue State adjusts its academic calendar by cancelling the third term. Plateau State government announces even more community testing to determine its COVID-19 caseload. And South Africa is to move to level 1 lockdown next Monday. International flights to start from October the 1st. It appears the feud between the Lagos State University unions, that is in particular ASU and NASU, and the state government has been resolved. Academic activities were disrupted on Monday when students and lecturers of the university were prevented from gaining access after the unions locked the main gate. Today, an agreement is said to have been reached between the Lagos State government and the Joint Action Committee of Staff Unions, that is ASU, SANU, NASU, and NAT, on the payment of the new minimum wage. The university campuses are now to be officially opened for normal academic and administrative activities, with lectures to begin for final year students on Monday, 21st of September 2020. Following the closure of schools across the country owing to the COVID-19 pandemic, the third phase of the eased lockdown has brought about state governments announcing different dates for the reopening of schools. In Lagos, the governor, Babajide Sanwo-Olu, had announced the resumption of state tertiary institutions for the 14th of September. Let's talk now to the secretary of the Lagos State University branch of the Academic Staff Union of Universities, ASU, Dr. Sylvester Idowu. Dr. Idowu, thank you for joining us on the program. First, confirm to us that this agreement indeed is real and that normal service will resume in LASU come Monday.
Thank you very much, my brother. Yesterday, we held a meeting, all the JAC officials, LASU JAC officials, comprising LASU, NAT, SANU, and NASU, as you rightly put that across earlier. We met the HOS head of service and the special advisor on education. In respect of our agreement, we had earlier written series of letters, and we put it to them that the school will not open until that was yesterday. But they showed us the governor's, written commitment that the HOS and the special advisor on education should agree with us that the payment will commence from October. And after the meeting, the JAC members met and resolved that we will go back to school and tell our members of Congress of our respective unions, and having gotten to school, we agreed that we would be open unfailingly on Monday, having secured a written commitment from the special advisor on education.
In that case, can we say that the students who were disappointed on Monday when they got to school and they couldn't gain entrance can return on Monday? What's to happen now? What will happen now?
Yes, the coordinator for LASU Information Services has placed it on LASU website that all academic activities will commence on Monday, and that is the official release from that unit of the university. And so I'm saying categorically that all the final year students, 400, 500, 600, depending on the years of program, the finalists will definitely resume on Monday. All the lecturers are duly informed. We held our Congress virtually yesterday to inform them about this development.
Indeed. Thank you very much, Dr. Sylvester Idowu, for this confirmation and for your time on the program tonight. Dr. Idowu Sylvester is the Secretary of ASU in the Lagos State University, confirming that indeed normal activities at the university will resume on Monday. Thank you very much.
Thank you, my brother. God bless you. Thank you.
Ahead of the placement examination scheduled to hold on September the 26th, 2020 for children in primary 6 classes, the Delta State government has distributed non-pharmaceutical safety materials necessary to help prevent the spread of COVID-19 while in school. Over 1,000 public primary schools across the state will benefit from the distribution, as the state government says proper monitoring exercises will be conducted across the state to ensure that the students and teachers are safe.
Head teachers from schools across local governments in Delta State converge on the central store of the State Education Ministry in Asaba, the state capital. They are here to pick up safety materials for students who are expected back in school. One after the other, they come to pick up items which include infrared thermometers, sanitizers, hand soaps and towels.
We have done nice the materials that they need. They need hand sanitizer, they need their soap to wash their hands, and on a regular basis, you need to clean your chairs, in most cases with water and soap, to make sure you disinfect it by the time you come every day. We have made provision of some towels also for them to be able to do that, not for them to clean their hands. And we have also supplied them face masks and so many other things that they require. Infrared thermometer is also there to test and check the temperatures that the students are coming in.
While welcoming existing students in the primary level back to school, state government insists on increased monitoring of students to ensure safety protocols are strictly followed.
So far, we've been very lucky and we're happy that we've not had any incidents since we started the phase resumption. And we also hope that this will be the same. But the difference right now is that we're going to increase our monitoring. The monitoring will increase because the children are younger. So, you know, the tendencies of them not keeping to the COVID-19 protocol will be there. So we're going to increase our surveillance, and for the short period they will be in the school on a daily basis, we have to be there, and every eye will have to be on them to see that they exit properly.
As these materials are handed over for use by all students, one hopes that these items will get to those it's meant for and serve as some non-pharmaceutical safety measures in combating the pandemic.
From Delta in the south-south to Benue in the north-central, where the state government has cancelled third term for primary and secondary schools curriculum for the 2019-2020 academic session due to the COVID lockdown. Instead, it has directed schools to compute first and second term results for promotion of students to the next class. The State Commissioner for Education, Professor Dennis Itiavia, discussed this while briefing journalists in Makurdi, while warning administrators of both public and private schools against charging parents for third-term fees for non-exit classes of GSS 1 and 2, SS 1 and 2.
Schools in Benue State have been shut down since the advent of COVID-19 positive cases in Nigeria. Full academic activities for the 2020-2021 session in Benue State have now been scheduled to commence on September 21st, 2020, with instructions to divide each class for morning and evening sessions to create enough room for social distancing among students with strict compliance to COVID-19 protocols.
Third term is cancelled in the case of other students, especially students in JSS 1 and 2, and then students in SS 1 and 2.
The state government also made clarification on fees payment and the new academic calendar.
Parents are not supposed to pay school fees for those classes, but for JSS 3 and SS 3, they have performed their third term, so their fee will be paid. I also want to say that when people resume, they will be resuming for the first term. And because some people were not able to complete the third term, the exam result for term 1 and term 2 will be used as a yardstick to promote students to the next class.
While noting that none of the students who earlier resumed for exit classes in the state contracted the virus, he says a strict monitoring team has been raised for resumption.
COVID-19 is changing everyone's routine, and the elderly are not left behind. Older people are being challenged by requirements to spend more time at home, a lack of physical contact with other family members, friends and colleagues, temporary cessation of employment and other activities, as well as anxiety and fear of illness and possibly death, their own and others. Even though the most affected age for COVID-19 is a group between the age of 31 and 40, about 70% of fatalities are in persons over 60 years of age, according to data from the Nigerian Center for Disease Control, the NCDC. Tonight, let's take a look at why care for the elderly should be prioritized, especially during this period of COVID-19. Joining us via Skype from the Solo area of Lagos is Mrs. Lillian Jiringo, founder and coordinator, Center for Happy Elderly People. Good evening, Mrs. Jiringo. Thank you for your time. Welcome to the program.
Yeah. Good evening, sir. Thank you for the opportunity.
Let me start by asking you about what have you seen has happened to the elderly during this period while everybody else is adjusting? How do you think they have coped with adjusting to their own realities with the advent of COVID-19?
The advent of COVID-19 was actually a terrible situation to the older persons in Nigeria. As is regards to how it is in our the old people's zone, that is our Center for Happy Elderly People, we thank God that there was nothing, no COVID-19 infection and all that at the home. But to the elderly, as per the Association of Older Persons, that is called Shepherd Elders Forum, there is a kind of abandonment and isolation as a result of COVID-19, because the relations are no more closer. I mean, they are not close to the older persons anymore. Like there was a situation where the son of an older person have to put on a glove, to touch the mother that is blind. And she got angry that this cannot be my son, was very angry. And all effort, the son tried to explain to her, but at the end, she still did not take it. She actually went into depression, and it was a very pathetic situation. So,
Well,
with the economy.
These are, I'm sorry to cut in, but these are the recommended medical imperatives to prevent the infections passing from less vulnerable people to more vulnerable people. But you were about to talk about the economics of it. There's also that aspect, because some of the older people as well have had to stop doing some of the economic activity that they indulged in before COVID arrived for more or less the same reason.
Yes. Actually, the older persons, some of them over 70 years, 80 years, they are still strong doing business in the marketplace. And to some, they could not continue the business. And it became a problem. The situation, became a problem that we have to, make provision on how to get them food or some things palliative. So they could not do any business. And the older person too, they didn't have any freedom, all, in the name of preventing COVID-19. No freedom. And meanwhile, the older persons, they have right to life, right to, freedom and social security, right to health. But the problem is when they are sick, you can actually not take them to the hospital. They could not go to the hospital. We have, there was one of them that was asking, we have to call someone to come and take care from the home, because it was a difficult situation having to get to some institutions in Nigeria that I will not mention. It took us time,
Let me also ask you about the feeding, because you are intimately you're intimately involved in seeing how these people live on a daily basis. Have you noticed any changes in the kind of diets, for example, that they are interested in, or the kind of things that they are able to now consume, since everybody talks about them boosting their immunity and the importance of them boosting their immunity so that they don't fall ill or fall victim to COVID-19?
About the feeding, I think by my profession, I was able to, because as nurses, there was no lockdown for us to get all the things that are important for them. We're able to get them, but it was difficult because the fund was not actually there. It was really difficult because there are a lot of things the older people make use of, like use of diaper and all that. Everything became so expensive, and the situation, even till now, we have not come off the effect of COVID-19 that is on economic effect of COVID-19 on the older persons, even as Center for Happy Elderly People. We are still trying to cope. For the feeding, we were able to at least put one-on-one to ensure that there is no nutritional imbalance.
What would you like, because the government is reaching out to various sectors of the economy that have been impacted, various categories of people that have been impacted by the negative consequences of COVID-19. Now, what would you like them to do for the elderly, knowing what you know about them and where they are? Life seems to be returning slowly but surely to normal. People have opened up schools, religious institutions, and all the other places that were closed immediately COVID came about have now reopened. So life seems to be returning to normal. What can government do to help the elderly also get back to some sort of normality?
I think government should should make some donations to the older persons, because the money they realize on their business, they are not able to get it. And then for the home, I think government should provide a kind of palliative to all the old people's home, because we have not recovered.
Old people's, when you talk about old people's homes, some of those who are listening to this program will talk about the fact that many Nigerians are not familiar with old people's homes, and the few who are familiar and those that they know about are in very poor shape. Most Nigerians don't take their elderly to institutions. They keep them at home. Has that changed now?
I think it's a kind of misunderstanding by the Nigerians that because they see older persons' home as a place of dumping, but it's actually what we do is promoting longevity. Because I see the older person, the Nigerians keeping their older persons in the home without any care, looking for a house girl or something to take care, cannot meet the health need of them. You understand? So older person's home is to actually promote longevity. We are giving the care. People don't know. And Nigerians are hiding under it. It's not our culture to abuse the older persons. And this is why we are campaigning that the older person's home is something it has come to stay. And we have to actually, take it up in Nigeria to ensure that it's all over. And apart from that, if we are talking about age-friendly community, the older persons can actually age in place. But we still need professionals who will take care of them. So if they don't know about older persons' home, we are now telling the public that older persons' home is very important, because there you have professionals, you have nurses, doctors, you have social workers, and physiotherapists, and all that to take care of the older persons in their homes.
Indeed.
In old people's home. It is not a
I'm
court.
sure they would. I'm sure they would say that it's a work in progress. But let me thank you, Mrs. Lillian Jiringo, for your time
It's not
tonight.
a work in progress.
It is a work
Yes.
in
It's not
progress.
a.
They will say it's a work in
We have.
progress because where we are and where you're saying we ought to be are a bit further apart. That's what I mean by work in progress. But let me thank you very
Okay.
much for your time.
We
Let me
have.
thank you for your
We've
time.
been there for 14 years. Yes.
And God willing, you'll be there for much longer. Thank you so much for your time this evening.
Amen. Thank you so much. God bless you.
When we return on our COVID-19 update, we'll take the medical perspective on the care of the elderly. So please stay on with us. Thanks for staying tuned. Welcome back to our COVID-19 update. From 35,725 samples tested within the last 24 hours, 90 new COVID-19 infections have been reported by the Nigeria Center for Disease Control, the NCDC. The cases are from just 8 states, with Lagos leading with 33. Other states include Plateau with 27, Kaduna with 17, Ogun 6, the FCT 4, while Anambra, Ekiti, and Nasarawa have 1 each. 5 new fatalities were also reported in 3 states. Edo had 3, and Cross River and Lagos had 1 each, putting the total COVID-19 related deaths at 1,088. States that have recorded over 50 deaths since the outbreak of the pandemic in the country include Lagos with 205, Edo with 103, the FCT 74, Rivers 59, and Kano 54. 93 recoveries were made in the last 24 hours in 5 states, with Plateau having the highest number of that at 47, Kaduna 21, Ogun 17, Edo 7, and Cross River 1. Even as international flights have resumed in Nigeria, the percentage of cases with travel history remains just 2%. 25% are attributed to contact of those with travel history, while community transmission is actively on, as over 70% of the cases are as a result of unknown exposure. Till date, Nigeria's total confirmed COVID-19 cases stand at 56,478. The number of recoveries is 44,430. Sadly, as you've been told already, 1,088 people have been lost to the virus, leaving the number of active cases at 10,960. More tests are to be carried out amongst the citizens of Plateau State, and that's in spite of the increase in the number of positive cases of COVID-19, which is a confirmation that there is community spread of the pandemic in that state. According to reports from the State Ministry of Health, 29,792 samples have so far been collected, with a total number of 3,142 confirmed cases, 2,088 discharged, and 1,015 active cases. 31 deaths have also been recorded, with 8 patients absconding from the isolation center. One of the test centers in the state, located at the National Veterinary Research Institute in VOM, has resumed activities after a while and has been receiving samples from states in the northern part of the country, with a capacity to test 1,000 samples daily.
The laboratory is a biosafety level 3 laboratory. That means it is very high-level laboratory that can handle not just the coronavirus, but other highly infectious organisms. We are able to do up to 1,000 tests per day, but we have not done that. So far, we have tested over 30,000 samples in our laboratory since it was accredited for testing. But by way of a slight challenge, now that the samples are building up, we need to increase our storage capacity.
In Plateau State, you know that the testing centers have increased. Now testing is going on in Plateau Hospital apart from NVRI in VOM, and the PTF itself has said categorically that most states have stepped down their testing. But Plateau State continues to test communities. As I talk to you, we have virtually tested about 70 to 80% of the civil servants. Local governments have started testing. Communities are testing.
Most state governors appear set to close the gap in COVID-19. Adamawa State Governor Umaru Fintiri, during the foundation laying ceremony of 2 cottage hospitals in that state, promised that a lot more will be done to uplift the sector. The governor is concerned that in spite of its growing population, successive administrations in Adamawa State did not consider the importance of building befitting health facilities across the state, which has made the fight against the COVID-19 pandemic more cumbersome.
The COVID-19 pandemic has not only brought about a new normal globally, but it has swept through countries unannounced. In Nigeria, the pandemic exposed the setbacks in the health sector, which some governors like that of Adamawa State are now trying to correct. It's against this backdrop that the state is invigorating its drive towards providing adequate health care for its residents as a way of checkmating the community spread of COVID-19. Residents of Gombe and Gire turn out in their large numbers from across the local government areas to witness the foundation-laying ceremony of a new cottage hospital for them. Governor Umar Fintiri, accompanied by members of the State Executive Council, state legislators and stakeholders, performed the ceremony. A community leader from Gombe says he's appalled by the havoc wreaked on the sector by previous administrations, while the Commissioner for Health appeals for support to turn things around.
So terrible on health challenges. When you have a sick person, you have to go to Garkida, or you go to Hong, or you go to Yola. You can now see that you need to cover a long distance before you get to see a doctor.
The cottage hospital is a 60-bed capacity hospital with all the clinical departments inclusive.
For the governor, this may not be the right time to trade blames, but the time government should work with all citizens of the state and ensure that the primary healthcare system is revived.
My government is taking every step to ensure that our primary healthcare system is made resilient and fortified enough to address emerging challenges.
For many witnessing today's event, the expectation is to see a rapid construction work that will bring about the completion of the cottage hospital, as this is one of the ways to prove that government is not paying lip service to healthcare.
And as promised, let's talk now to consultant public health physician Dr. Alera Roberts. Dr. Roberts joins us tonight from the town of Ondo in Ondo State. Good evening, Dr. Roberts. Nice to see you, although today you're a bit further down the line than normal.
Thank you very much for having me, Ladi. Yes, I'm all the way up in Ondo Kingdom.
All right, we're talking about the elderly today, and even though the demographics of COVID-19 talk about those between the ages 31 and 40, yet most of the over 1,000 people who have died already in Nigeria are 70 or 60 plus. They're in the older age bracket. What do you think they can do to make themselves less vulnerable to COVID-19?
Well, unfortunately, Ladi, you are very right. And it so happens that I am one of these old people myself. The truth of the matter is that their vulnerabilities are twofold. They've got the vulnerability of age by virtue of the fact that they are more likely to have underlying medical conditions. And these are things that are sort of, have come up as a result of poor eating habits, and, or type 2 diabetes, hypertension, and stuff like that. Then there's another problem, the psychosocial issues that can then arise by virtue of being lonely or virtue of being elderly abuse, virtue of not being in the right place at the right time and not getting access to the right kind of care. So, what they can do to help themselves, it would be difficult if ab initio they're not empowered to do so. If you've got elderly people who are living with other members of the family, then yes, they may have to maintain some kind of social distance, and the other members of the family have to take care to make sure that they're not passing on the disease by going in and out of the house all the time. I do know that there are quite a lot of old folk who, since the lockdown, have not left their homes. They are so afraid of catching this virus. But then that doesn't speak to the vast majority of the elderly who live in the lower socioeconomic brackets, that don't have access to good health care, don't have access to good diet, don't have access to the kind of family support that is needed to make sure they can be safe.
Now, part of what you said already can be emotionally fraught. Our guest who spoke before you gave an instance about, for example, social distancing and how it is next to impossible for a son to explain to his mother why he needs to stay away from her, or if he talks to her or touches her, he has to do so with a glove. And that this can be extremely distressing. It can be difficult or impossible to explain. How do you overcome this kind of social interaction problems?
It is very difficult, and you know the issues are that you could not even explain such a thing. And then don't forget that these are also people who are separated by the digital divide, so they don't even get the benefit of what we are doing, talking via screens, via video conferencing, and so on. These are things that we needed to have set in place long before now. It's what we call health literacy. And, you know, I keep coming back to this because it's a very cogent point. The breakdown in our health and education systems is why we are where we are today. How do you explain to people who don't even have a frame of reference of disease causation that a son is now going to stay away? I mean, I know of some friends in the UK, as it so happens, whose 29-year-old daughter has not been to see them, it has not been into their house in the last 9 months. She gets to their house, she sits in her car, a distance away, they sit on within their front door, and they maintain almost a 12-foot distance to carry out a conversation. No hugs, no taps on the back, no companionship. It's very difficult, and you know, these are the things that a lot of elderly.
We seem to have a bit of a connection issue there with Dr. Roberts. We'll see if we can get her back there because the point. All right, I understand that Dr. Roberts is back. Dr. Roberts, please continue.
No, what I'm saying is that we are having issues with the elderly being affected not so much from the virus as from the effects of the social distancing and the separation that this virus has caused.
You gave an example now of the United Kingdom, and this is where a lot of those who are in Nigeria at the various levels are concerned. But then the young, those who are younger, those who are obliged to take care of them and so on, are also to some extent confused about how to go about this. And this probably, COVID-19 has only made more problematic, as it were. But if you're going to talk about medical prescriptions, for example, I know that at some point there were those who were recommending all kinds of vitamins and immunity boosters in terms of medications to help the elderly. But these do not get administered in isolation, do they?
Well, yes and no. You do need a whole continuum of care. You do need a good diet, you do need the companionship, you do need let's be basic. You need to have the face coverings, the hand washing, the social distancing. You need to have water and sanitation. You need to be able to give the high dose vitamin C, particularly, and other immune boosters. But and also as important is that you need to be able to maintain their psychosocial health, keep them happy, keep them in company so that they don't get lonely and depressed.
All right, then, Dr. Roberts, thank you so much for that. I'm sure that in the days to come, the elderly, of course, will again feature on this program. And do have a safe trip back when you're through. Dr. Alera Roberts joining us from Rundu. Thank you very much. Outside our shores, South Africa is moving to level 1 lockdown, and this comes with reduced restrictions, an economic stimulus plan, and limited international travel. Speaking to South Africans tonight, President Cyril Ramaphosa gave details of what's to come, as well as some of the terms and conditions attached.
Decided this morning that the country should now move to alert level 1. The move to alert level 1 will take effect from midnight on Sunday, the 20th of September 2020. The move to alert level 1 will mean a further easing of restrictions on gatherings, social, religious, political, and other gatherings will now be permitted as long as the number of people does not exceed 50% of the normal capacity of a venue or the facility. But this must only be to a maximum of 250 people for indoor gatherings and 500 people for outdoor gatherings. Health protocols such as washing or sanitizing of hands, social distancing, and mask wearing will need to be strictly observed. The maximum number of people who may attend a funeral is increased from 50 to 100. With a move to alert level 1, we will gradually and cautiously ease restrictions on international travel. We will be allowing travel into and out of South Africa for business, leisure, and other travel with effect from the 1st of October 2020.
President Cyril Ramaphosa. Well, outside the African continent, millions of Americans are still suffering from COVID-19. And the director of the Centers for Disease Control and Prevention has told U.S. senators today that after a safe and effective vaccine becomes available to protect against the virus, it will probably take 6 to 9 months for enough Americans to get vaccinated to significantly affect the pandemic. Correspondent in Washington, D.C., Maria Bird, has more.
The U.S. could reach over 400,000 COVID-19 cases by the end of 2020. As Americans begin bracing for the fall and winter seasons, which may not only be plagued with COVID-19, but the seasonal flu.
It may or may not be. We think we'll be in better position to respond at that time because we've had a chance to build up the public health infrastructure. If that happens, it's going to be really complicated because we're going to see patients presenting syndromically with things that look like COVID. So influenza A, influenza B, they can present with high fevers and symptoms that could be consistent with COVID.
Recent reports indicate that the U.S. may have known about the coronavirus since December of 2019. The U.S. president defends his position on why he did not share the severity of the virus when he was made aware.
I heard it was an airborne disease. I assumed it early on. The fact is, there has to be a calmness. You don't want me jumping up and down, screaming, there's going to be great death, and really causing some very, very serious problems for the country. If Bob Woodward thought what I said was bad, then he should have immediately, right after I said it, gone out to the authorities so they can prepare and let him know. But he didn't think it was bad, and he said he didn't think it was bad. He actually said he didn't think it was bad. The only one that said it was bad or thinks it was bad were the fake news media, because they take it and they try and put it a certain way. If Bob Woodward thought it was bad, then he should have immediately gone out publicly, not wait 4 months. You know, he's had that statement for 4 months, maybe 5 months.
As the U.S. battles with curbing the virus,
the fight is not yet over.
The recent overturn of the Pennsylvania governor's COVID-19 restrictions by a judge appointed by President Trump, ruling that the restrictions were unconstitutional, is calling to question what will be next for America. From Washington, Maria Bird, Channel Television News.
All right, let's talk to Maria now. She joins us from Washington, D.C. Good evening, Maria. Nice to see you. Let's begin with the issue of this vaccine and the possibility of the vaccine before we get to President Trump. Of course, it was President Trump who said that if these vaccines become available, they'll give it to everybody. But is it going to be free?
Yes, the federal government is stating that they will ensure that every American has the vaccine and that it will be free. And so that is only time will tell with that, because again, that is a federal government mandate that's come out of the executive branch. And so will that really be able to hold true through the actual, when you talk about pharmaceutical companies, talk about insurance companies, there's a lot to making a vaccine free. And so I'm not sure if that will truly be able to happen as we look to potentially not even seeing a vaccine after some of the news today until maybe this time next year or this summer of 2021. And so we could potentially even have a new president by then. So it just depends on what the political landscape looks like once the vaccine is released.
Speaking of presidents, President Trump has been in the news a lot over the last couple of days with whether or not he did. How much of that is playing out on the election campaign trail? How much his opponents making of whether or not he knew what he knew and how he presented it and all of that? How is that playing out?
Well, I mean, there's obviously a lot of question around whether or not he knew earlier what that would have meant. But the reality is many people that are concerned about the coronavirus are not necessarily the supporters of President Trump. Many Trump supporters, as we've seen in many of the rallies across the country, and most recently in Nevada, they're not wearing masks. They're in close quarters. I mean, you see many individuals don't believe that the mask wearing. We've had people protesting wearing masks. And so those who are supporting him won't most likely be affected by this new news about when the coronavirus was actually, made aware of to the federal government in the U.S. And so he probably will continue to have his base, but those who are on the fence or those who are supporters of presidential candidate Joe Biden on the Democratic side, they will probably become that much more eager and ready to advocate for and begin to campaign even harder for their candidate.
Something else that is going to make the battle against COVID-19 a bit harder is this declaration by a federal judge that some of the restrictions in some of the states are in fact unconstitutional and that therefore they ought not to have been imposed.
Yes, and Pennsylvania is the first state of that. We have cases in North Carolina and a couple other states across the country. And so this is setting a precedent. And so we will begin to see potentially states across the country, stating that these restrictions are unconstitutional. And the question is, what will that really mean for as the U.S. heads into the flu season, as the U.S. heads into colder months? And it's always been speculated that the coronavirus thrives in colder climates. And so what will that mean for the next weeks and months in the United States if we are going to be loosening the restrictions that many states have put in place?
The other thing here is that, of course, the economic news isn't looking too good, especially after the Congress failed to pass the second stimulus package for COVID-19 that was widely expected and then shockingly didn't go. How is the economic scene playing out with all of this?
Well, we're headed into the fourth quarter here in the U.S., and so we're in a time period where this is really going to determine what will be the ending of the fiscal year here in the United States. And what we're seeing with job numbers, we're entering the holiday season. So you'll begin to see a deep decline. And we also know that many individuals who had rent moratoriums, eviction notices, all of these things are going to start to become heavily played out in the U.S. And we're going to begin to see people, being evicted from homes, not being able to pay their rents, and some basic everyday needs. So the stimulus package was critical and key to stimulate the economy beyond just helping people. It was also going to be stimulating the actual economy as we enter to the fourth quarter, ending the year.
Thank you very much, Maria Bird, for the reporting, and do continue to stay safe out there.
Thank you so much. You as well.
Maria Bird joining us from Washington, D.C. And that's our package of COVID-19 update for tonight. Please go to our website, channelstv.com. Always check for updates on all our stories, both on COVID-19 and other topics such as politics, economy, business, and sports. Tomorrow we'll be back at noon and then at 6 at 9 at fresh packages of COVID-19. I'm Ladi Akere Duluale. Do have a good evening and do continue to stay safe.